Hello, thank you everyone for joining us. My name is Jacqueline Ventura. I'm a community health worker for the Partnership of Maternal and Child Health. As a community health worker, I work with many women who have been thinking about getting vaccinated against COVID-19. Today, we will be speaking about the importance of the COVID-19 vaccine and pregnancy. Joining us today is Melanie Rodriguez and Ruth Mulero. Melanie, if you could please introduce yourself.
Sure. Thank you for having me, Jacqueline. My name is Melanie Rodriguez, and I am a former community health worker with the Partnership. I have a public health background, and I'm a mother of two beautiful children. I just had a baby in August.
Thank you. Ruth, could you please introduce yourself?
Absolutely. Hi, my name is Ruth Mulero. I'm a registered nurse here in the state of New Jersey. I'm also a nurse home visitor with the Partnership for Maternal and Child Health of Northern New Jersey. So as a nurse home visitor, I work with first-time pregnant people and kind of guide them through the pregnancy and through the first 2 years of their child's life.
Well, thank you for being here. Let's begin. Ruth, I know that there's a lot of information about COVID-19 that is changing constantly. So it's understandable that expecting people may be confused about getting vaccinated. I wanted to know, is the vaccine safe for those who are pregnant or trying to become pregnant?
Yeah, absolutely. I understand that concern that this is a novel virus we've never experienced before. So the information is constantly evolving and changing. And yes, actually this vaccine, COVID-19 vaccine, is safe for those who are planning to be pregnant, who are currently pregnant, and who may have already given birth and who are breastfeeding.
Okay, thank you. Why should someone who is pregnant or planning to become pregnant get vaccinated?
That's a great question. One of the reasons I would say it's like a 2-for-1 shot. You get one shot and you're protecting two people at the same time. You're protecting the person who's pregnant and you're also protecting the unborn child. So that's a really effective way to get the vaccine. Also, once your child is born, children under 5 cannot be vaccinated yet. They're still working on those trials, and hopefully within the next few months, we'll be able to vaccinate children under 5, but currently that's not possible. So the best way to protect your child right now, if you are pregnant or planning to become pregnant, is to get vaccinated while you are pregnant.
I know you just went over it, but are there any additional benefits from getting vaccinated?
Yes, absolutely. So besides just passing the antibodies to your child, for yourself and your child, being vaccinated means that you are protected against COVID. It doesn't necessarily mean that you will never get an infection. However, if you do get infected with COVID-19, you have a better chance you have better outcomes. So one of the things is that your symptoms will probably be mild or no symptoms at all. The other thing is that you are less likely to be hospitalized, and currently people who are pregnant are actually a very vulnerable group because during pregnancy, your immune system is suppressed in a way, and so it's actually easier for you to get, as a pregnant person, to get infected with various other infections, including COVID-19. So that is one benefit, that it'll reduce your likelihood of having severe disease, reduce your chances of being in the hospital and having to stay in the hospital. And also on top of that, it reduces your chances of dying.
Okay. Pregnancy is a special time for expecting parents, but it can also bring a lot of anxiety. I know that you work with a lot of moms. How do you talk to your moms about getting vaccinated?
So with anybody that I talk to about vaccines, I always approach it as just trying to find out where they stand as far as vaccines. In particular, a lot of my clients that I work with who are pregnant or have just delivered, so some of them are breastfeeding or are away already, have stopped breastfeeding. But a lot of the questions, they'll vaccinate for very well-known vaccines like measles, they'll do, DTaP, they'll do the pneumonia and others. But with COVID, I think the issue that I'm finding is the anxiety over it, is that it's so new that they're not sure what the long-term effects are. And so far, I mean, we've had about almost 2 years of studies on this, and it's one of the great things is that during the initial trials, there were people who became pregnant during the trials. And I think Melanie is going to mention a bit about what her experience was like being pregnant and getting vaccinated. But there are not very many long-term effects that we found. Mostly they're the short-term effects of like, sore arm, soreness around the body, maybe like feeling like you're coming down with being sick or something, but those are expected side effects. Those we expect to happen within a couple of days of getting the COVID vaccine. But those should go away after a few days. And so far after that, there hasn't been much as far as long-term effects, which is great.
Great. Melanie, you recently had a baby. Congratulations.
Thank
You made the decision to get vaccinated. Could you please tell us why?
Sure. So as soon as I learned that I was pregnant, I was overjoyed. I was having a baby 7 years later after my first. But at the same time, I was very nervous because I was having a baby during a pandemic, like many people. And I knew that meant that I had to keep myself as healthy as possible. So I wanted to limit my contact with friends and families. But at the same time, like a lot of people, I was very hesitant and anxious about getting this vaccine. At the time that the vaccines were coming out, there wasn't that much information around it. I didn't even get an opportunity to even speak to my doctor about it. But I just knew it was important to protect myself since I was part of a vulnerable group because I was pregnant. And so I just knew that getting COVID would just be far more dangerous than the side effects of a vaccine. So that really influenced my decision to get it.
Could you tell us a little bit more about what other factors you considered when making this decision?
Sure. So yeah, like last year I did have COVID and it was just a very difficult time for my family and I. I remember I was feeling scared and afraid. I didn't really know if I was gonna even get better over time. Like I just had no idea how my body would react to this. So that really made me take into consideration what would happen again if I became sick again with COVID while I was pregnant and didn't have a vaccine. I didn't really want to put myself in that situation. I have a daughter who has a history of asthma and she wasn't even qualified to get the vaccine. So I just wanted to do anything in my power to protect my family and control what I could do during this time.
Melanie, you are also breastfeeding. Did that affect your decision to get vaccinated?
Absolutely, yes. So as soon as I learned that I was pregnant, I instantly knew that I wanted to breastfeed. It was something that I wanted to do and I had my mind set on it. And the only thing that I kept reading online was that there would be some sort of immunity that I could pass to my baby through breastfeeding if I was vaccinated. And I was convinced that, this could happen just like with other vaccines that you take when you're pregnant to protect yourself. So this really encouraged me to continue to breastfeed for as long as I can. And I just knew that it was something that I needed to do to protect myself.
I agree with you with getting as much information as possible and, speaking to your healthcare provider. I also wanted to ask both Melanie and Ruth, we talk a lot about pregnancy and vaccines, but how important is it for the partner in the relationship or other people in the household to also get vaccinated? Melanie, if you want to start.
Sure. I think it's extremely important. I think it's a conversation that you should have with the people that live in your home, along with your partner, because it really does reduce the risk of everyone getting sick. I remember during this time, my sister was pregnant as well. My sister and I were pregnant at the same time. And my sister really wasn't convinced about getting vaccinated during this time. And I said, if you want to be around friends and family and you want to feel safe, it was best to do your research and think about if it was best for you to get vaccinated. And at the end, my sister did research. She spoke to her doctor that she trusts, and she eventually did get vaccinated. But I thought that it was extremely important because it does protect those that you love and who can't also get vaccinated. There are children under 5 that still can't get vaccinated. I remember during this time, my daughter was 6. She could not get vaccinated during this time. And the only way that I really could protect my daughter and the people that I love who couldn't get vaccinated was for me to get the vaccine.
I absolutely agree with what Melanie said. It's super important. When I talk to my clients, usually there's multiple people in the household, multiple generations. And as Melanie said, you know, and as I said earlier, children under 5 can't be vaccinated. So this is the best way to protect your child. And also those who are vulnerable, those who are, you know, a lot of us live with grandparents, parents and grandparents that are older. And so that also protects them as well. So I definitely encourage my clients and to speak to their family, and definitely encourage them to ask me questions. I'm always, like I said, I'm very open to any kind of question. There's no such thing as a stupid question, because I want people to ask. And same like what you just said, as talking to your healthcare provider, absolutely, talking to the nurse practitioners, talking to the registered nurses, talking to the physicians, the physician assistants, everybody, talking to those who work in healthcare, because they have a really good grasp of why, you know, of how to answer those questions. And so I always encourage, if you still need more information, go to your healthcare provider for sure.
I also want to ask both of you, what advice would you give to people who are pregnant about pregnancy and the COVID vaccine? Anything else that you would tell them? Melanie?
So, yeah, Jacqueline, at that time that I was pregnant, I was working closely with clients, and I was no longer a community health worker. I was a community member of the community, because I was a living testimony that it was important to educate yourself on all the risks and benefits, to speak with a provider that you trusted, that had your best interest in mind, that would tell you real information. And I would also encourage them to ask questions. Like Root mentioned, no question is stupid. That there were so many questions at that time that I had with my OB, because I didn't know anything. And I really wanted to make an informed decision that was in my best interest, and not hear things or be convinced by friends and family. I really wanted to do something that had my best interest in mind and protected myself and my family. So it provided me with comfort again, so that I could be around my family and friends again. And I'm just so happy that I made that decision.
I absolutely agree with everything you just said. It is so important to get vaccinated. But for every person, I think I would definitely, like Melanie said, she became a patient. She became part of the community when she became pregnant. And so each person is different. Each person has different concerns about the vaccine and why. And, I've seen it evolve. In the beginning. I noticed that it would be, well, it's so new, what are the side effects? And I'm going to wait till somebody I know gets the vaccine. And then as slowly as people started getting vaccinated, now it's changed a bit. It's more of just, well, now it's turning into, well, everybody's getting it, so why should I get the vaccine? So I think it depends on what the information's out there. And also it's so constantly changing that I definitely always gauge what the person knows and feels first before I offer any advice, and find out what matters to them, because it is a very individualized decision. Even though vaccination is one of the best preventative methods that we have against COVID and is very effective, it is the most effective prevention at this point in time. And so I highly always, even after talking, engaging where people are, I will even say, like, maybe you have concerns and you're hesitant, but I highly recommend you get it anyway. And so I always definitely address their concerns and anxiety over it, and then finish off with, I still recommend it even with all your concerns.
Well, I agree with both of you. I think during this pandemic, we became part of the community, and we don't realize that our actions actually affect those around us and those who we love, and getting the vaccine will help protect the ones that we love and everyone around us. Well, I appreciate both of you for taking the time to speak about the importance of pregnancy and COVID vaccinations. For more information about COVID and pregnancy, please visit the Partnership for Maternal and Child Health website. Thank you for being here.
Thank you.
Thank you.
To wrap everything up, I wanted to reiterate some of the points that we spoke about today. First, the COVID-19 vaccine is safe and effective for anyone who is trying to become or is pregnant. He also spoke about the benefits of getting the COVID-19 vaccine during or prior to pregnancy, which include lower hospitalizations, lower risk of complications, and increased immunity toward COVID-19 for the baby. Lastly, the vaccine is easily accessible and has little to moderate reactions that go away quickly after administered. To get more information about COVID-19 vaccinations and pregnancy, please visit the CDC website and speak to your healthcare provider today.